Women are increasingly redefining traditional roles like marriage, family life, careers. What do you see as the number one barrier in why women struggle to communicate their needs today?
We live in a culture that kind of stuck in this swirling trifecta of silence, stigma, shame.
Stereotype number one is that women want to be married. Stereotype number two is that women want to be mums. And stereotype number three is that women will ultimately put their families before their careers.
Jessica Zucker is psychologist helping women name the shame we've been conditioned to carry around motherhood, miscarriage, and ambition.
She's on a mission to stop letting outdated stereotypes define what women should want.
The career piece is big too. Is it quote unquote selfish of me to want to focus on my career and put off having kids or decide to not have kids at all? We need to open up the conversation to be able to have multiplicity, like that we can have multiple things happening in our lives at once. Can we dare ourselves to talk about tough stuff? Research shows girls are kind of taught to silence even their period symptoms when they first get their period.
What do you feel is kind of like the biggest struggle that people have voicing their reasons behind this conversation? Because it's becoming louder from the stats, but no one's really talking about it.
Well, it's interesting. I mean, from a patient perspective, the people who come to me are typically...
Firstly, I want to say thank you to tuning in and listening to the show. It means a huge amount. And connecting with all of you is something that I absolutely love as part of this journey of growing the show. One of my biggest goals of 2025 is doubling the reach of this show. And I can't do that without your support. So I would love to ask you a favor. If you can press subscribe or follow on whichever platform you listen to. This helps us reach more people. And for me, elevating women in science is so fundamental and ethical and scientific information. So if you feel the show empowers you and gives you the information that you've been seeking, I would love to ask a favor in return and to hit that subscribe button and help me reach the goal that I've set for the show of 2025. Thank you. Jessica, welcome to Live Well, Be Well.
Thank you so much for having me.
So I'm very excited today because women are increasingly redefining traditional roles like marriage, family life, careers. We're two career women having this conversation, which I love. But, as we all navigate these very complex choices and understanding driving factors, it's really important to help empower women how they can kind of hold these values that are important to them, right? To make the right choices for them. So I loved this quote, and it was actually, when I was researching this episode, I pulled this quote out and realized that it was in your book from Maya Angelou, which is, "There is no greater agony than bearing an untold story inside of you." So I thought the number one question I wanted to start with was, what do you see as the number one barrier in why women struggle to communicate their needs today?
Beautiful question. I love this. I think that we unfortunately live in a culture that is kind of stuck in this swirling trifecta of silence, stigma, shame. And because of it, women in particular seem to keep their very important stories, their formative stories, to themselves. And then what happens? What happens when we stay silent about something that has transformed our lives, some trauma, some drama, something beautiful even, is that we start to, why are we keeping it quiet to begin with? Why? Because perhaps it's stigmatized in our society. Perhaps it's considered taboo to talk about it. And then by keeping it hush-hush, by squelching it, by pushing it down underneath the surface, we begin to feel a sense of shame. And so much of my work is dedicated to trying to understand and unleash this sense of shame that so many women are struggling with. I mean, so many people in general, but women in particular tend to turn things on themselves, tend to blame themselves, tend to go to a place of, my body failed me because I had a miscarriage. Maybe my body doesn't work. Maybe I should eat more of this or less of this, trying so hard to have control where we don't always have a sense of control.
Well, I think it relates to another great quote, which is by Virginia Woolf, which is, "I'm not one and simple, but complex and many." And that's something that I've definitely discovered about myself as I've grown and as I've become maybe more confident and more vulnerable. But it took me a really long time to get there. And my understanding of this is that, I've been really lucky to speak to over 350 people on this show. And I think that's naturally brought out for me a lot more vulnerability because I see other people's vulnerability quite starkingly. And I'm sure you have that with your patients as well. But for kind of someone living at home, maybe, we have a huge rise in loneliness right now. People living on their own, maybe more removed from their friends and family. I know we're talking about women, but I would say anyone in general, get more to feeling that they can share their stories or their worries or their concerns with one another, because there is a big friction at the moment here.
Yes, there is a loneliness epidemic. That is for sure. Yes. And that friction, I think, comes from potentially and originally this place of, can I take up space? Is it okay to ask for what I need? Have I been taught through society and or my family and or, the world in general to keep these matters quiet? And so I suggest, and I know it's sort of a big ask, right? But I suggest compassionately daring ourselves to speak our truths into the world. Now, that does not mean that somebody has to do what I did and create a campaign and get on a soapbox about it and, start a whole thing. We don't have to start a movement in order to be connected to community. It can be as simple as writing in a journal. Because I think the thing is, when we have our stories locked inside of us, in our hearts, in our bodies, our minds, there's this potential for festering that then again morphs into maybe shame or maybe more of a sense of loneliness and isolation and alienation even. And so even if we just write it down, it is no longer just within us. You can burn that piece of paper even. Other options are, of course, telling your best friend, talking to a trained professional, a psychologist, for example. Or if somebody is prone to being more public, posting about something can usher in a sense of commonality and community that perhaps will make an impact on that feeling of loneliness and isolation.
Well, I love that you basically went there in 3 steps. One from, very on your own without speaking to anyone. One, connecting to one person that you trust. And then the third one, basically putting it out in a public sphere to see how many people resonate and connect. But I love that you gave 3 options, because when I did a conversation last summer on friendship and the power of friendship, I saw some of the comments actually on YouTube for that episode, and it really saddened me because a lot of people were like, I really understand the value of friendship, but I don't have anyone to speak to. And we kind of forget the ease of, saying reach out to your best friend. And some people might not be able to identify with that they have a best friend. And so I think, starting with the journaling is really helpful, because it's you can do it in the safety of your own home. And sometimes writing it down and reading it back, it can really allow you to reflect and see, is this justified in how I'm feeling? And I think, that's actually a really good, simple way. Maybe people will never get to the step 3 of publicly sharing, but I think it's a really lovely way of maybe I'm building up to the next phase of being able to share that with a therapist or potentially someone that I trust.
Yes. I mean, another option that's sort of in between, because you just mentioned that not everybody has close friends or a best friend, is kind of, if people are comfortable with this, getting involved in online forums or an online group where you don't even have to use your name, but you can potentially find support on whatever topic it is that you're struggling with and connect there, but in a more maybe distant way, so that you're not sort of expecting it to be this deep, historical friendship necessarily, but instead offering tidbits of support on a specific topic.
Do you remember a time when you reached out to your friend and it was something that you were struggling with, and you actually got the reassurance back? Because I remember that, and that actually helped me become more open over time. It actually had such a profound effect that it allowed me to kind of continually want to do this.
It's interesting you put it that way. I thought you were going to ask the question the opposite way, that when you open up and you hear something back that you don't want to hear, what do you feel? Because I talk so much about how alienating platitudes can be in the face of pregnancy loss, in the face of a cancer diagnosis, in the face of grief. I think it's actually the simplest to just be present with somebody. And for some reason, culturally, it's been difficult for us. And I don't know if it's because people are so uncomfortable with uncomfortability. And so they want to kind of clean it up and fix it, quote unquote, and come in and offer a silver lining, oh, you're going to be fine. You're so strong. You're a warrior. You're going to meet your person, you're a badass, like all of these ways in which, friends try to be cheerleaders, which is of course lovely and well-meaning. But sometimes what we really need and want is, I hear you, I see you, and I want to be by your side through it all. That's it. There's something so transformative about that,
It is. Well, you put 3 stereotypes in the beginning of your book, Normalize It, which is coming out in April. And I really loved them because I guess for anyone listening to this, I really hope men are listening to this. I know we have a lot of amazing, wonderful male listeners, but maybe their partners or friends will share this to them as well. But you put down 3 different stereotypes of women. Okay. So you put a stereotype number 1 is that women want to be married. Stereotype number 2 is that women want to be mums. And stereotype number 3 is that women will ultimately put their families before their careers. And before we even just have a little discussion about those 3 stereotypes at the beginning of the book, I think someone listening to this will resonate with either all 3 of them or one of them in some way, shape or form in today's society. And I think that's where it's a really good place to start with this, because actually are we actually being true and authentic to ourselves, or are we doing it? And are we trying to live a certain way because we feel that's what's expected of us? And I think I've definitely tried to break through that a little bit, being 35 and, making my own choices where I am for currently at the moment. But it feels very stigmatized to maybe talk about them.
Yes. And I think what you're saying is also do we even know? Right. So it's a lot of us do want to be married. A lot of us do want to be mothers, and a lot of us do want thriving careers. But do we even take the time? Is there even the space to think through these decisions? Or do we feel required to step into these roles because it's what's expected, it's what we've seen, and it's what kind of culture demands in a way?
It does. I think it's interesting. I think in some shape or aspect, maybe, let's go to the child one. That's quite an interesting one to talk about at the moment for a whole mix of reasons. So there's more and more women debating not to have children. There's more and more women maybe really wanting children, but maybe potentially not finding the right partner. And there's a huge conversation around why that is currently in society. Some women feel that, now they're not finding partners on the same level terms as them. And so there's lots of different reasons why we are having a drop in women having children. I think you said it's 2% every year. It drops since 2014. So it is declining, and it's definitely not on the incline at all. But there's definitely like a kind of a stigma around having this conversation. Why do you think we feel so ostracized and worried about having this conversation around children?
I think that, well, like your parents are sort of tiptoeing, I think that it's expected that we all 100% want children when we're small. Like that when we're kids, we are playing mommy and playing house. And that is just not always the case. And so I think the people who fall outside of that, I was not somebody who played with dolls. I was somebody who in my 20s basically said to my parents, if I meet the right person, if I meet somebody who I can envision doing this with, I want to do it. But will I do it just to do it? I'm not going to do that. I was pretty clear about that. But not everybody feels they can be so convicted like that. Not everybody knows what they feel, like we were talking about before. They feel sort of in this swirl of cultural expectation that, ooh, I secretly don't know if I want children. Maybe I do singularly want to focus on my career. And what is wrong with that? But because the conversations aren't being had out loud, or at least not frequently enough, people tend to then feel sort of ashamed. Like, ooh, am I bad? Is there something, quote unquote, like wrong with me that I don't necessarily want to become a mother? Or that I would rather maybe wait until my 40s to become a mother and hope for the best then and see what that's like. We need to open up the conversation to be able to have multiplicity, like that we can have multiple things happening in our lives at once.
I've spent years in the fashion industry, but also years as a scientist trying to understand how our bodies are meant to move. And I'll be honest with you, most shoes are terrible for our feet. I know this firsthand. For years, I wore the wrong shoes, ones that looked great, but in reality gave me persistent back pain and messed up toenails. I searched everywhere for a pair of shoes that wouldn't just support my feet, but would also help them heal. And I struggled because most healthy shoes don't exactly scream style. And then I found Vivo Barefoot, something that finally looks good and actually works. I wear mine with cargo pants, awesome leather trousers, a crisp white tee, and my favorite sunnies. Not only do they feel great, but they really fit my style. Wide, thin, and flexible, these shoes allow my feet to move naturally the way they're supposed to. And the best part, just 6 months of barefoot shoes can increase your foot strength by 60%, helping to undo the years of damage from conventional footwear. Now, if you've ever had the same problem and tried to find a shoe that supports your body without sacrificing style, then this is it. Try Vivo Barefoot for yourself and feel the difference. You can get 20% off if you use the code LWBW20 at vivobarefoot.com, where the T's and C's apply. Trust me, your feet, your back, and your outfit will thank you.
Clients that come to you around this age, what's the kind of variety of conversations that they're having with you, whether they are struggling and they haven't managed to have children, when they haven't found the right person, or whether they just fundamentally don't want children? I mean, there's so many reasons why people don't have children. I think we very much put them in a silo, one box, which I think is where the problem of this conversation is coming from, rather than the openness. There's such a variety of reasons. And actually, it's maybe not one's place to ask, but it should be one's place to be able to share. What do you feel is kind of like the biggest struggle that people have voicing their reasons behind this conversation? Because it's becoming louder from the stats, but no one's really talking about it.
Well, it's interesting. I mean, from a patient perspective, the people who come to me are typically in grief. So I specialize in women's reproductive and maternal mental health and have done so for about 15 years at this point. And so I'm mostly seeing people who do want to be pregnant or do have some ambivalence around pregnancy, but are here to talk about it, to kind of figure that out. Like this concept of maternal ambivalence is not talked about enough. There are a couple of great books out there about it.
Can you explain what that is? Just for anyone who doesn't know what that term means.
It's sort of what you would guess it is. It's this kind of like, I think I want it. I don't know if I want it. I thought I wanted it and now I don't really want it. And like you said, there's so many factors that go into that. People are realizing it is prohibitively expensive to raise children. People are also realizing that, wow, I've got this, smashing career and I don't want to change that, and so I think people are allowing themselves to think more about the ways in which having children will impact their lives. And so the ambivalence can come from, my mom didn't seem that happy growing up. I don't know if I want to be like that. Like, what if my family history of depression comes through when I have a baby or in my offspring? There are so many deep things to think about upon potentially becoming a mother. And when people go there, and that it's such an honor to sit with people as they're wrestling with this, because that is the essence of vulnerability, to really look at one's family history and to say, I didn't feel wanted, I didn't feel loved, or I didn't feel that unconditional presence. How will I know that how do I know I can do that for my child? And the career piece is big too. Is it quote unquote selfish of me to want to focus on my career and put off having kids, or decide to not have kids at all? So these are the things that I'm hearing about. But, I often see people who are struggling with fertility issues, or have had a miscarriage and are terrified to get pregnant again. And this really brings into view the question of, will I become a mother now that it wasn't as easy as I thought it would be? Now I want it all the more. Now I'm even more terrified of pregnancy. And because there's no guarantees, even if you go the route of reproductive, assistance and technologies, no one can know the outcome. And I think that really gets at, especially high achieving women, it gets at this like lack of control. You can eat all the right things. You can do all the right things. You can have sex at the exact right time. You can, do the injections the way you're supposed to, whatever it is. We don't know. No one can know.
I think you said something so beautiful in our 5 questions on the Substack, which is, you said, it's so much easier to blame ourselves because we have a sense of control. And when you said that, it related to so many parts within my mind, within my clients' minds, within friends and families, that it is much easier to blame ourselves for things that have gone wrong, because I think ultimately we can feel like we can try and control situations. We have an outcome on the end result. How can we release that blame? I mean, you just spoke about something very specific there, which is a miscarriage, which I think can bring, as you said, that kind of triangle of silence, stigma, and shame into play very, very quickly. But how can we try and I am preferencing women here because they are the ones who will be dealing with a miscarriage, but also I want to have men in this conversation. How can we release that blame from ourselves to basically allow, which is one of my favorite words, to kind of let go of the situation that's affecting us?
I think it actually takes quite a bit of work because of the cultural messaging and because of the family upbringing sometimes. I think in some ways men have it even worse because they've been taught from the get-go that they shouldn't cry, or, that they should shove their emotions even deeper down. Women, on the other hand, I see, at least in my practice, tend to blame themselves more because, somehow it must have been something that I did in that friendship, in that relationship, in that miscarriage situation. We have to drill down in order to upend the blame and to bid farewell to the silence, to the stigma, and to the shame. We actually have to drill all the way down to, what am I actually feeling?
That's hard for
I
one
feel
to describe.
sadness. Yeah. I mean, so but when you think about it, we can just keep going with the, example of miscarriage. Oh, what did I do wrong? Maybe something's wrong with my body. Maybe it was an eating disorder I had when I was younger. Maybe it was that sip of wine that I had before I peed on the stick. Maybe it was having an orgasm last week that made me have a miscarriage. All of these things, it's my fault. So when I say to a patient, wait, let's just pause. What are you feeling in your body right now? What are you feeling? And with that space comes the tears, or even the anger, but feelings, rather than that grasping at control and the grasping at blaming something that they think they could have done or didn't do that created an outcome that they're unhappy with. So I think in order to get away from self-blame, we actually can honor ourselves even more deeply by just saying, what's underneath this? What if I didn't do anything wrong? What if I'm sad and I want to know that next time it'll be different, or that, whatever else we're hoping for will be different in the future? Maybe because I don't know, I'm blaming myself, and I'm hoping that that will give me a sense of agency. And maybe it won't. So I think it's about having to be more closely with our vulnerability, our insecurities, and our sense of humanity.
I think it's like, it's very, Brené Brown is somebody who I always admire when it comes to vulnerability, right? And she has this incredible gift of being able to talk about vulnerability, storytell vulnerability, and somehow lace it with science without us realizing. And there's something so powerful about that formula. And I think, not all of us are great at storytelling, but I think what we can learn, or what I feel that I'm hearing from you and, what I was reading in your book, is that we can try and tell maybe a different story and narrative to ourselves, rather than the one which is of rumination and blame and not being good enough.
Exactly. And so how do we do that? How do we rewrite the narrative, right?
Give me one line.
The truth is, even if it comes through that journal writing, why can't we just dare to say, maybe I am enough? Maybe this wasn't my fault. Maybe I deserve good things. Maybe I can talk about hard things. It's really just trying to turn the narrative on its head and trying to see it from another perspective. And now there's no sort of magic potion to feeling better. This isn't even with the hope of feeling, now I just popped out of depression and now I feel hopeful and amazing. No, but it's just trying to show oneself that there's another way that we can look at it, and that culture may be feeding us something that doesn't actually resonate and that isn't even true.
I think when we go into that part, right, when we start really exploring ourselves, something that was a small part in the book, but not a large part, but you did reference it, was attachment theories. And we've spoke about that briefly on the show, but not for a very long time. How much do attachment theories play into this narrative?
I love that you brought this up. Yes.
And for anyone who isn't aware, I think most of my listeners might be, but can we explain very briefly the attachment theories and how this kind of plays into maybe the suppression of our feelings and emotions and how that actually impacts us?
Yes, I'm so glad you brought this up, because I do think family history, of course, because I'm a psychologist, I do think family history plays a huge role in the development of our identities and who we are and who we come to be in the world and how we navigate relationships. So basically, attachment theory, if you boil it all the way down, is saying, if your caregiver was consistent loving, present, you will have an easier time forming bonds and bonds that last.
And can I also ask, part on
Yeah.
there, is it also a bond with yourself or a bond with
Yes.
others?
I mean, yes, that can be, I would think that that's inevitable. Yes. That because you felt comfortable and confident within your family system, that allows you to have sort of a calmer stance in the world. You might believe in yourself, or you at least believe that when you don't feel good about yourself, you can go to somebody about it and that you feel responded to in an appropriate way. Conversely, and this is, the other extreme, and then there's a couple of other attachment options in between. But if somebody, for example, grew up in a physically or emotionally abusive household and a very unpredictable situation, alcoholism, drug abuse, physical or sexual abuse.
Or even just parents arguing. It doesn't even have to be that extreme,
Yeah, I mean,
right?
the parents arguing might be one of the more middle attachment options, but this extreme one makes it so that somebody is in that kind of fight, flight, or freeze mode. And it gives them a sense that adults, that caregivers, that mentors, that people are not necessarily safe, because their caregivers are the very people who ruptured that idea, who made them feel useless, worthless, insignificant, abused, forgotten about. And then, then there's these two other options sort of in between, where there are parents that are responsive, but a little less consistent. Or like you're saying, they're so caught up in their own lives, and maybe they're arguing a lot, like you said, or they're sort of never around, or they're having an affair. And so they're not at home much and they're not attuned to their children. That might give a child a sense that, I want to be close to people, but are people safe? Oh, wait, some are safe. Oh, wait, so it becomes confusing for that child to know who they can trust, who they can't, and how they feel about themselves.
So with what you just explained, the 4 ones that I've read about are secure, avoidant, ambivalent, and disorganized in the book. So with the ones that you explained, I guess we know that secure is growing up where you're feeling heard and you then respond much better as an adult to harder situations and you understand your needs more. But can you explain those other 3 that we just said and how they fit into the ones that you just described? So people might be able to resonate which one they are.
Avoidant, ambivalent, and disorganized. Right. So the example I gave earlier about disorganized is the more sort of abusive, pretty chaotic, if not outright scary home environment. And then the ambivalent is wanting to be close, but fearing being close, wanting to share, but not knowing if they can share. And avoidant is sort of turning away a bit from connection. Maybe not altogether. It doesn't mean because you don't want to sort of now run out and think, oh, my friend that's shy must have an avoidant, attachment. It's not like that at all. It can be very subtle and very specific to certain situations. But I think, avoidant is, can I trust that people will have my back, that people will be there for me? So it's not that they grew up in an outright scary situation necessarily, but like we were saying before, there's this kind of inconsistency in the household. And so it does make it a bit more difficult to believe that relationships can be consistent, and it can make it hard for us to choose healthy partners sometimes for us. If what we saw growing up was chaos and drama and the highs and the lows and the black and the white, we might think that's love, or we might think that that's exciting, or we might think that is something that we should be able to handle and ride for the rest of our lives, when in fact that situation will likely implode.
And so I guess so much of the work that, we were talking about in the beginning, which is around being able to vocalize your needs and understand what your needs are and, be able to share your stories. I guess a lot of it can connect back to these attachment theories then, that if you are worried about how you're going to be judged or looked at, or if somebody's going to reject you, all of these kind of other fears within oneself is also really important to be able to share your story.
Yes. There's an important addition, though, to the research that came later, the psychological research about attachment, and that is called earned secure attachment. Okay, so this is very hopeful research, and I love to bring it up, and I like to kind of apply it to my patients' lives as well, which means that if somehow either we luck out or we have the insight to be able to say, ooh, I grew up in this chaos, I don't want that. And we have, let's just say, an ongoing relationship with a therapist where we actually have a reparative situation happen where we can say out loud, I'm worthless. I feel, I'm nothing. And the therapist is there to not just say, no, you're not, but more so to say, what does that feel like? Who said that to you? Where do you think that was coming from? And really help the person understand that it was all projection. It has nothing to do with them. A baby, a little person can't be worthless. It's the caregiver that feels that way about themselves that is spewing that all over the family. And so this beautiful idea, I think revolutionary idea about earned secure attachment is that, this idea that we can have healthier relationships that somehow then have a reparative element in our lives, in our future relationships.
I think that's the power of being able to connect back to yourself and not disconnect, and being able to feel brave enough, as Brené Brown would say, to step into this moment and actually be honest with yourself, which can be really difficult because sometimes I think labels can really actually affect us more. And so if we constantly think, oh, I'm an insecure attachment style or I'm an avoidant attachment style, or we kind of lead with that preference, we kind of secure it in our minds that that's who we are and that's what defines us. And I think the beauty of why I love that you just said that is because that doesn't define who we are. That just defines where we are at the moment. And so if we can kind of do that work, right? And I think we can all flux, if we've had a horrific relationship where we have been betrayed, we're probably going to be maybe more anxious or more avoidant because of that situation.
Totally. Yes. I love that you just brought that up, that there is opportunity for change, that we can then usher in people, professionals, friends who can bring us back to a place of health and ease and knowing what we deserve, even if we came from a family that taught us that we don't.
The subtitle of Unpending the Silence, Stigma and Shame That Shapes Women's Lives. Why did you feel that this was going to be your second book? Because I know you had such a profound first book where you spoke so vulnerably and authentically about yourself and your journey and a miscarriage that you went through, and it was a very vulnerable book. What was it about this book why did you want to write about this, about normalizing these conversations? What was it that drew you and empowered you to write this?
I feel like this is my passion coming to life on the page. Like I feel like this is my life's work, is sort of trying to carve us out of this ditch that culture has put us in, that is unfair, that is unfounded, that is unhealthy. And so when this publisher came to me and asked me to write another book, I was game, because it felt like I want to expand what I'm talking about because at the time I was writing so much about miscarriage after my own miscarriage, and because I work so much with miscarriage, I wanted to expand my lens because in my practice, I work with so much more than miscarriage. And I wanted to look at everything from menstruation through menopause and then some, everything in between. Body image, eating disorders, all of it, all the things, all of the potential milestones that women go through, sexual trauma, the friendship stuff, sex, all of it. Because, I think we're just ready to be done with the hush hush requisite, silence that surrounds hard topics. And why are they even hard topics? Everybody gets their period and everybody goes through menopause. Why are we not more educated about these things? And why can't women, we don't even have to be proud and having parties necessarily, but why are we hiding it and feeling like quote unquote dirty? And, in the book, I talk about like, even in biblical times, like it was made to feel and sound like women were somehow needed to be sort of in a separate space during menstruation. So all of these things that are sort of, milestones that we will go through, we need to be able to talk about them. We need to be able to express what we're going through during it. So kids, the research also shows, this is in the book too, that girls are kind of taught to silence even their period symptoms when they first get their periods in adolescence. What is that? That's the beginning of it all. That's the beginning of the silence. That's the beginning of the shame of like, ooh, something's wrong with my body. Ooh, I'm supposed to, have this brave face and just, be a quote unquote good girl and keep it all together, even if I'm having period cramps and not feeling like myself today. And so I just want to breathe some space or, breathe some life into these cultural conversations that I think we can have more comfortably or like more confidently, or I want to normalize them. I just want them to be part of everyday life.
We speak really open show about like a hybrid of different topics which comes to health, and I think people have to the biggest thing that I saw when I went back to change my career and study nutrition health and then go on to create a mental health foundation was I was like, people actually know a lot of the knowledge, but without hearing stories and without connecting and having an emotional connection to what's going on, it goes over one's head. And we kind of forget this in like the language that we use, maybe even behind closed doors, maybe not even publicly, with, I guess there's the simple conversation of like, how are you? Which you can say to your best friends. And then they go, yeah, I'm great. How are you? And it kind of just ends there. And that's a very like top line that we all know that we do. But It is interesting. Like I kind of like want the listeners to kind of just sit there and go, yeah, how often do I actually do that? And how often am I not okay? But there is this like really grey area, and I don't know if you agree with me. Well, like we don't always. I don't want to sound like complaining, but we don't always want to be going, "Oh, I feel awful" every time we see someone, because then also at the set, because I also don't want to make this about, I know that I've had those people around me that every time I see them, there is a problem. So you also then have that like heaviness. So How do we navigate this, right? As I don't want everyone to go out and every moment of every second explain that everything's hard. So how do we, it's a nuanced area. How do we
totally
deal with this?
And actually that's an important point. Yes. In no way am I saying that people should walk around with like a black cloud and just say every bad thing that's ever happened to them. No. No,
well, because there's a fear, right? There's a fear of people interpreting that the conversation in that way, which I don't want people to misinterpret it. But.
No, I mean it more sort of globally, that can we dare ourselves to talk about tough stuff? Period. Not every day, not in every conversation, but just it rather than like, ooh, I'm good. Well, meanwhile, you're like going through divorce, you're going through infertility, you're like thinking about, moving across the world. Like, we just don't want to be hiding the important things in our lives.
We don't want to be
and especially
disconnecting.
Exactly.
Right? That's
exactly.
the biggest thing.
Yes. But I want on to the point though of the person that you're talking about that, every time you see them, there's darkness. I do think though that, there's something, daring about the fact that they're sharing that, and or it may represent though the fact that they are desperate for help. And it's not our job as friends necessarily to like recommend that they go to therapy, but if we are noticing that a friend is consistently talking about being in the darkness and always ruminating on hard things, then it is time. And the book really talks about this. It is time to talk to a mental health professional, because our friends can only go through so much with us. Our friends can only help us so much. And we can only grit our teeth and bear things so much on our own as well. And at a certain point, sometimes we need to talk to somebody. Sometimes we need medication to help us get through. And so, yeah, I don't think that we need to be only talking about hard things all the time. Absolutely not.
No, but I guess I said that in a way of there is this like interesting area that I think it's so important that we feel that we don't burden friends, and that we feel that we can have these conversations. But there is, ironically, someone will listen to this and know that there's always that one person that comes all the time. And so there is a kind of an interesting balancing act, which is where, I believe that that's when a therapist can come in as well, because you can shed as many things at a therapist constantly. You never have to say anything positive if you don't want to, and then finite it through friends. But it's interesting because I had a conversation with somebody recently. He was a friend, someone that I knew, who was a friend, and we went for dinner, and I actually had told her about some things that I was struggling with. I was quite vulnerable in that conversation, which actually tipped her to become very vulnerable and tell me that she had been diagnosed with ADHD, but she felt very shameful about it. And I could see this shame kind of pour over her, and then trying to tell me that she was, trying medication, but she was very scared, and she promised that I wouldn't tell anyone. And, that she was really struggling with, I guess herself, she was struggling to process being diagnosed at a very later age in her life. And I've seen that with a lot of my friends that have had maybe a diagnosis of something later in life and really struggled with it. In that moment, how can we hold space for that person? When rather than sometimes trying to fix it, which I think many of us want to do and be like that problem solver, how can we hold space, or how do we know if that's the right thing to do? How do we navigate that? And two, how in that moment can we support that person?
Well, I think those are hopefully synonymous. Holding space and supporting can kind of be one and the same, depending on the way we go about it, right? So it sounds like you had such a beautiful dinner, and you did this for each other. It's like you opening up made her open up, and then but you get at such an important point, which is what's the inclination? And it comes from love, but why do we want to fix? Why do we want to tidy things up? Again, it's trying to make things good again. You're going to be fine. It's going to be good. It's going to be great. You're going to get back to yourself. The fact that she opened up shows that she trusts you, and that she, I think, so badly wants to feel better. And there is shame sometimes in diagnoses later in life, because maybe they've been struggling their whole lives and they didn't know. And now they finally have a name for it, but now they have to do something about it. So there's going to be relief maybe, but then it has this name and maybe they don't like the name.
So how do we deal with that shame? I guess that's the thing, because I think that doesn't have to apply to anyone that's got ADHD. It can apply to anything when someone's let off something onto someone else, but you can see they're struggling with that shame. How do you, because it's such a hard word to even describe, right? Shame's such a heavy word.
I think all it takes is just listening, to be honest. I mean, I know that sounds overly simplistic, but it's just, I'm here for you. And thank you so much for sharing this with me. And if you want me to be sort of along for the ride, I want to be. I mean, obviously you only say that if it's genuine. But I think that is support in its most beautiful, distilled moment. We don't need to be like, well, have you tried this doctor? And have you tried this herb? And have you tried this vitamin? And have you worked out enough? And did you go to acupuncture? Like, that doesn't feel good. For me, when I bring up, which I really rarely do because I do think it makes people too uncomfortable, and it makes me uncomfortable as well. If I were to say to a good friend, I'm afraid, there's a part of me somewhere that is afraid that I will be diagnosed with breast cancer again. How does someone sit with that? It's like, because if someone loves you, they just want to say, there's absolutely no way. My friend, da 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 da, and my aunt, da 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 da, and, provide stories of, resilience and health and longevity. But that doesn't actually honor my fear. And so I don't bring this up much. Even my own husband has difficulty being with that feeling and that fear in me. Yes. So I talk about that in therapy. And what is the fear? The fear is my kids losing their mother. My fear is my body sort of going through something that I can't control. My fear is not being here long enough, those. And so when I can explore the depths of that in therapy, I'm freed up. It doesn't mean the fear fully extinguishes, nor should it, but it means that I can talk about my feelings in their entirety.
So how can one distinguish, I guess, if they know they're living in fear and shame? I guess they kind of sit quite close together from hearing that in your analogy, because the quickest reaction I think for most people is to run, and to go, oh my gosh, I'm going to distract myself with the 5 other things around me, like my phone and my laptop and going out to stores. And I'm going to do that meditation that I've not done in ages because I don't want to think about what I need to think about. So how can we connect that if we're feeling shame? Because it's quite like a nuanced word, I think. I think we all actually know what shame is, but do we? Because even having this conversation, I'm kind of going, when is it that I feel real shame?
Yeah, I mean, shame is like feeling bad. I have some patients that I think they think they're bad at the core or feeling shamed. Sometimes it can be from, having social anxiety. So someone can have a dinner and then that night in bed, they're ruminating over something that they said. And that can be shame. Like, oh, did I say the wrong thing when my friend told me X or Y? I think that the best way to be with our shame is to let it be there rather than, as you said, distract. And I think distraction techniques, though, when we're going through certain things can be very helpful. But when it comes to shame, if we don't deal with it, it does expand and it can eat us whole. And so I think trying to understand, and it's back to the attachment stuff. Why am I going here? Why am I feeling so insecure? Why am I feeling that I'm bad or I did something wrong? And then trying to see if we can release that. Can I give myself grace to be human, but can I also give myself grace to not do everything right and to, have this fear eat me up and make me feel badly about myself, but put it down.
Sometimes and I think it's an amazing practice to write down a gratitude list or things that, we're very grateful for and all these things to try and help, redirect our thoughts. Sometimes it can be good just to brain dump all the crap that's in our minds on all the things of, well, what's the worst situation? Or what are the things that is really kind of getting to me right now? Because I sometimes think that I think the gratitude is an amazing and it has so much evidence behind it. But I sometimes don't think that we actually acknowledge how often we shroud ourselves in these feelings and whether we can connect to that shame. Because I think maybe everyone will lay in bed with a great analogy that you just said, that did I say something to upset that person at a dinner? Or did I come across in the wrong way? Or did that person take that in offense when I didn't mean it in that way? And we can kind of sit there and process these things constantly. And that's quite interesting because I think a lot of people won't relate that is potentially shame.
Yeah, I mean, it can turn to shame, because it's like, ooh, I always do that. Oh, I always put my foot in my mouth. Oh, maybe I'm not like as good of a friend as I thought I was. Maybe she's a better friend. Oh, maybe I'm, should try harder, and that's when like the cycle, the spiral can take hold and just go bananas.
So what do you recommend someone to do in that moment? Because I think everyone's going to listen to this and go, yeah, I had that last night. I had that last week. I had that 2 minutes ago. What can one do in that moment?
I think it's really kind of trying to stop and name it. Right now, I'm having some anxiety, or right now I'm having intrusive thoughts, or right now I'm having anticipatory anxiety. And I am a good friend, and my friend knows I love her, and I have options. If I want to, tomorrow I can reach out to her. We can get back on the phone. I can explain what I meant, or I can see if tomorrow I feel differently, because, we can get into these loops that are just not true if we have enough anxiety. And then somehow the next morning, magically we feel differently.
I know. Isn't that odd when we can just kind of snap out of it? Sometimes I get voice notes from my friends where they've had a really tough few days, and then all of a sudden the next day they're like, I actually feel great today. And we're like, how did you come to that? And they're like, I don't know. I just woke up and I felt much better.
Well, yeah. Or it's like, I got my period, so now I'm feeling better. I always ask one of my closest friends, because she'll tell me she's, in a dark place and whatever. And I'm like, where are you in your cycle? That's my first question. And I'm not a medical doctor, but and then she's like, oh, I never keep track. And I said, well, just look in your calendar, look back. And she's like, oh, I'm supposed to get it in 3 days. So sometimes that can be helpful to know where we are in our cycles and what's happening with our hormones, or what's happening even, nutritionally, to affect our moods, because we can sort of be up and down based on that.
From having this conversation where maybe people can feel scared to share and to vocalize, do you have any practical steps and how? I mean, I know that we spoke about in the beginning journaling, and we spoke about maybe potentially then speaking to a friend. For anyone that's kind of struggling with that shutdown of that next step, what are some kind of ways that people can try and feel more comfortable in not getting rejected when they're sharing how they feel?
Well, here's the thing. There's no guarantee of what we're going to get back from another human being. And so I think the magic is in trying. So even my daughter the other day, totally different thing, but she entered into this art contest, and she's like, ooh, I hope I get it, whatever. And my husband and I kept just saying, it's just great you tried. How amazing is the thing that you created, and the outcome really isn't the important part, which of course to her, it is, but we will continue to impress upon her that just trying is the kind of, I think, revolutionary part, because it's so easy to not try. Why? Because we fear that we won't get it, or we fear that people won't like it, or we fear all this stuff. So fearing being rejected by opening up makes all the sense in the world. And again, bring in that compassion. I understand why I'm scared of this. I understand why I think this person might not hear me or shut me down, but I want to do this for me, because as we can't control other people. We can't control most things, but we can control what comes out of our mouths. We can control what we do and what we say. And so I think just trying can be life-changing.
I think so. I think, we hear about it a lot in work, which is failure as feedback. But I think we have to really use that within our emotional health, that every time we feel that we've tripped up or done something wrong, all of this is feedback into how we operate and how our minds are and how we feel in certain situations. And I think that's like the power and I guess the wisdom. We had an amazing conversation on here with John Baverde all around, understanding the meaning of life and how wisdom plays a big role. And I guess if we don't step into rejection and failure and mishaps, then actually we never get the feedback for ourselves because we're so individual in each one of us. We've all had different upbringings, different cultures. And so no one's going to be able to actually give you the answer. And I think like a lot of myself being able to maybe speak a bit more openly on this show is having kind of that own feedback from myself to then feel more confident to bring out the next part. And I'm not sure if you maybe had that in writing the second book, maybe where you felt a different confidence around writing and sharing and maybe being more authentic in parts and words that you say, because you've kind of had a bit more of a journey. And so I think sometimes like the hardest part is the first part because you don't know what's going to happen.
It's true. But like, don't you think that like then without trying, we miss out on resilience? So if my daughter doesn't win this art contest, she'll just have to learn that she didn't win and what to do with that disappointment. And we can't take that away from her. And these are things that need to be learned early on. And then you just see that like, oh, I keep on going and I keep on creating and I keep on trying. And I think if we miss out on that in our early lives, it does make it a lot harder to engage in relationships and engage in vulnerability.
The epicenter of it all.
Yes.
It reminds me of one of my favorite quotes, which is that empathy draws connection and sympathy draws disconnection. And I feel like there's so much power in that. In when someone opens up and you can empathize because you've been there and you share it, you feel more connected, which is actually something that we need more than ever in today's world. But when you kind of like sympathize, get, oh, sorry about that. Oh, sorry you went through that. Oh, must have sucked. You kind of not looking down, but you're not on a deep empathetic connection. Some person feels very withdrawn. And so we kind of exacerbate the person feeling more lonely in that situation. So
yeah, I think platitudes can do that too. When we try to fix it and we say, at least you can get, you can get pregnant, or at least you're young, or at least you're,
that drives me nuts career. When people say that.
And it's so alienating and it does shut people down. And yeah, so I think when we come to conversations with more of an openness and not trying to change somebody or fix them, we're not equipped to fix them. I'm not equipped to fix people, and I'm a psychologist. I'm here to facilitate deeper thinking about one's history and their present life and how those connect. I don't think anyone feels helped by feeling like a project that somebody's trying to cobble together or change or fix.
No, that's that sole person's journey. No one else's.
Exactly.
So Jessica, this is the last question that I ask all of my guests.
Okay.
Which is, what does live well, be well mean to you?
It means living with intentionality. It means doing the work. It means trusting yourself to know that you are capable of that. And I think just trying to be honest and open with oneself first, and then hopefully in the world.
I love that. Intentionality is such an important topic for ourselves, because if we don't have our own intentions, we kind of don't know where we're going. So there's so much power behind that. So thank you so much for coming on. Thank you for, writing such an empowering book for women. And And yeah, thank you for kind of spreading the power of storytelling.
Thank you so much for having me. This has been such a lively and meaningful conversation.
And for anyone who is listening, this is going to be on sale on April the 22nd. So go, and if you want to learn more about your stories of the clients that you see and parts of your journey and, why we are in the situation where we might feel disconnected and potentially suppressed in having these conversations, it's all in there. So thank you.